Welcome back to Root Cause Holistic Health. Today, we're talking about something that affects every single one of us, but most people rarely think about it until they have a toothache. Your mouth. What's happening in your mouth be connected to chronic inflammation, fatigue, poor sleep, or even your overall health.
Welcome to Root Cause Holistic Health. I'm Dr. John Harmon, physician, brain health expert, and your host on this no-fluff journey into whole body healing.
And I'm Tracey Green, wellness coach, mom, and co-host in this space where we get real about what actually heals, not just what's trending.
We're here to help you uncover what's really going on and empower you to take the next step in your healing journey.
Dr. Harmon, I will let you introduce our guest today.
Oh, thank you so much. It's a great lead up to what we're going to talk about. It's a very, I would say, one of those things in your life that leave a big mark. And I'll explain that later. But my dental health, my oral health, let's just say that I couldn't go to work for 2.5 months, and we'll talk about that. But I'm really excited to introduce you to my dentist. Full disclosure, she's been my dentist for years, and I've just appreciated her work, her thoroughness, her attention to detail, sanitation, cleanliness, and all of those things that we'll talk about. So Dr. Veronica Montgomery, she actually practices in Boise, Idaho. She's a board-certified naturopathic dentist. Have you ever heard that term before? Most people have not. Practicing holistic and biological dentistry. I told you where that is, Northwest Boise. She graduated from the University of Pacific Arthur A. Dugoni School of Dentistry, San Francisco, California, with high honors. She was the dean's salutatorian. She was voted as a member of the most prestigious National Dental Honor Society, the Omicron Kappa Epsilon National Dental Honor, that's a mouthful, Society, the American Dental Association, the American Academy of Implant Dentistry, the International Academy of Biological Dentistry and Medicine, the Holistic Dental Association, and the International Association of Mercury Safe Dentists. I'll bet a lot of our listeners haven't heard that term either. Mercury Safe Dentist. I thought all mercury was safe. That's why they put it in our mouth. Dr. Montgomery was the first accredited member of the International Academy of Oral Medicine and Toxicology in Idaho. She was also the first SMART certified, which is safe mercury amalgam removal technique in Idaho, and the first ozone certified dentist in the Treasure Valley, and second in the state of Idaho. She has received awards in the field of periodontics, implants, and oral maxillofacial surgery. She has done several internships in preventative and emergency dentistry. Dang, no wonder I've never seen these in the office. You'd have to have a whole room for plaques. Dr. Montgomery, we want to welcome you to the show. We're really excited to have you, particularly me, because of the role that you played in my health and rescuing me out of a bad situation in my teeth. And so, welcome.
Thank you. I really appreciate being here. Thank you.
Welcome. We do have some questions for you.
Sure.
To start out. What is the difference between conventional and biological holistic dentistry?
I think biological and holistic can get kind of interchangeable a little bit, but conventional dentistry is, your regular dentist. You go to the dentist, and you get your teeth cleaned, and a biological and holistic dentist takes care in choosing the most biocompatible materials we can find, whether it's for your cleaning, it's for your fillings, cementing your crowns. We avoid fluoride. We use alternative methods of trying to avoid tooth decay. We use ozone, we disinfect everything with ozone. We don't like infections in the mouth, so we always use computerized tomography to find, hidden infections that cannot be found, and, with regular x-rays. But it's mostly, you avoid infections in the mouth and you get rid of the infections in the mouth. Use the best materials you can find, the most biocompatible. We will try to do, not for all patients, but for the ones that really need and want to have biocompatibility testing done. And we really try to avoid causing any systemic problems for the patients. And if they have any systemic problems coming to us that we know could have been caused by anything in the mouth, we're going to try to remove those causes to see if the patient's health will improve.
I've had a lot of dental work done over the years, and especially root canal. But we'll get to the root canal question later. I'm curious, what's the biggest health connection that surprises your patients the most?
Well, I think it's infections, actually, because patients come to us a lot, to the biological dentist, because they have amalgams. They have mercury fillings in their mouths. So, there's a lot of buzz around, amalgams lately. So patients come to me from their physicians, from their naturopaths, from their chiropractors, and because they want their mercury fillings removed. And they get surprised when they find out that actually they have infections in their mouths, and that actually the infection can be more detrimental to health than the metals.
Do you find those underneath amalgam fillings?
Not necessarily, right? But amalgams rust, right? These mercury fillings, they rust in the tooth in a way that they
never heard
grow,
that term, rusty,
right? So,
mercury rusting.
So they go through an oxidation process, right? So they're aging, and they can swell in the tooth. And they can go beyond, the flexural strength of the tooth, and the tooth can crack. And so we know teeth with amalgam fillings are more prone to cracks than teeth that have white fillings. And because the filling tends to grow in the tooth, right? And so cracks can lead to more infections, but I can't say that, amalgams will harbor infection underneath them, but they're more likely to cause an infection in the tooth because of a fracture than a tooth that has a white filling.
So the tooth could fracture that would allow bacteria to enter in. Is that
exactly?
Okay.
Mm-hmm. Yes.
My uncle was a dentist, and I don't remember him teaching us to floss, but every time we'd go up to the city, it was about 40 miles away. We're going to the dentist. I'm getting mercury fillings. And I had them all removed in the 90s. Thank goodness.
Yeah. So I think that's an important point to make right now. I'd like to back up just a little bit, because there's still people, I've had all my silver fillings removed too, because I had a lot put in as a kid. I think that's something that I'd like to point out to our audience. If you still have any type of silver in your mouth, it's imperative that you get to a biological dentist, because I know there's a right way and a wrong way to remove it as well. Get to a dentist and get it removed. That's what we were making a good point here, to say that silver needs to get out of your mouth.
Well, mercury, right, is 50% of the filling content, right? And so because of licensing requirements, we're not allowed to say that mercury fillings are bad for your health, but they do cause teeth to crack more, right? Because they grow in the tooth. If there's a reason for the filling to be removed, whether it's because you don't like the color of your filling, your tooth is cracked, or whatever, right? For your own decision, you want to have that filling removed, it is imperative that you have it removed by someone that has been certified, or that at least knows how to use the SMART technique or the PROTECT technique, because you're being protected better than if it was just removed conventionally, right?
Yeah. And I also went through ozone training, and I'll never forget when the biological dentist was showing photos from his office, and you may know who it is, but I'm telling you, they had hazmat suits on. Every surface was covered. They had this big vacuum right next to the face, getting all of the mercury out into a filter. You can't put it out in the environment because it's toxic. But it was impressive, the amount of work to get those out, just to get them out of a person if they want to have them removed. And that's what you're training in. Is that correct?
That's correct. So there's a video from the IABDM that shows the amount of mercury that gets released when a filling is being drilled on. And it goes way beyond what is allowed by OSHA, right?
Oh, my word.
In a workplace environment. And so think about it, right? It's not just you as the patient, but it is the assistant, which is an employee of the dentist, that could be causing toxic exposure to mercury vapor in the workplace. And that's a big OSHA violation, right? And so go ahead.
Pardon me, I've seen a documentary about just measuring that vapor from a filling that exists in the tooth, not when it's being removed. I've seen them video that, and it's going up into your sinuses and brain. I know you can't talk about all that stuff, but I can. I've seen those videos of that.
Yeah, we know that mercury is the most dangerous element to us, right? Besides radioactive elements. And so if I can't say anything bad about the fillings, right?
Sure.
But we can talk about mercury. So, the fillings do vaporize. It's a fact, it's a known fact now. No one can deny it, right? Yeah. At an average of 10 micrograms of mercury vapor per day.
Oh, dear.
Is that healthy? Is that within safe limits? Or it could be, depending on your genetics. So if you win the genetic lottery, right, and you're able to detoxify from this mercury exposure very well, then okay, you may decide that, okay, this removal is not for me, but you are still exposing the ones near you, right? So I'm here in a small room, my consultation room, patients come to talk to me. It's a very small room, maybe, a 3x3 room. We close the door to speak in privacy. Sure. And if these patients have, 10 fillings in their mouths and they're in close proximity to me in a small room, enclosed room, I am breathing their mercury vapor too, right?
Oh my.
And so it's your partner, it's your children, it's anyone in close contact with you, because the fillings are constantly vaporizing. They will vaporize more if they get touched, which means that if you're grinding your teeth, if you're chewing, right, they also vaporize more when it's warmer in the mouth.
But Dr. Montgomery, I'm wondering why I don't feel well. And then you have a mouthful of mercury.
And exactly. And then you have, these good detoxifiers that have a great genetic makeup, and they may be able to detoxify this mercury, daily mercury exposure. But then you have a vast amount of the population that have genetic variants, right? And they don't have the same genetic power. So you can't come with a blank statement and say that this much mercury exposure in a day is safe.
Because nothing is ever the same for
exactly,
everyone.
Because we all have different DNAs, and because we have, how many people have MTHFR variants?
I was going to ask
a ton, right?
Oh yeah,
and
others.
It's COMT, right? 50% of people have a COMT null gene, which causes us to build up, estrogen and adrenaline, because that gene, that enzyme, needs magnesium to function. In the presence of heavy metals, the magnesium gets kicked out, right? So now that enzyme doesn't work.
I think the light is going on for a lot of people in our
And
audience.
so if you think about, right, now I'm building up bad estrogen metabolites, I'm building up adrenaline, epinephrine, right? I cannot control my stress. I have anxiety. I have panic attacks, right? And not only that, so let's carry on into that. Okay, I'm a great detoxifier. I can live with my feelings. So what happens when you die? Where are they going to go? Or you're going to be cremated? So this is not an individual problem.
Wow.
Right?
So that's going into the environment.
Oh my gosh, that is huge.
Collective problem. It's a community problem. Oh, you're not going to be cremated. You're going to go buried. Okay, it's going to go in the soil, right?
Wow.
So,
mind blown.
Yeah.
Yes, mercury from dental offices is one of the biggest pollutants of wastewater, right? And a few years ago, we got all excited, the biological dentists, because finally the EPA was going to force all dental offices to have amalgam separators, right? And now I just found out a month ago that it's not required for all offices.
Oh my.
Because if you're not removing or placing mercury fillings all day long, you don't have to have an amalgam separator. So guess where that piece of amalgam that you just removed, maybe once a week, it's going to go, right?
In the landfill.
Exactly. Because it goes to the sewer goes to the landfill. So what are we going to eat, right? What are we breathing? And so it's not an individual problem. It's a collective problem, right? It's an environmental problem, not just a health,
And so you have people coming in, my husband says to me, why don't you just calm down? Not even making a connection between mercury and the anxiety.
Oh, yes.
And they could go to a psychiatrist, get some meds, but the actual origin of the problem will still exist and persist.
Yeah. Well, let me tell you what was happening to me, right? Because I could never handle estrogen, hormone replacement of estrogen, right?
Yeah.
And I've been working with the same doctor, she's a great doctor here in Boise for years. I'm like, I need estrogen. But anytime I try to do a tiny little bit of estrogen on my skin, I go crazy, right?
Wow.
I mean, I'm fighting with everyone. I'm trying to divorce my husband. I mean, and it happened so quickly within like 2 weeks. Well, now I know why, right?
Oh my goodness.
The toxicity, like my mercury exposure, right? My own mercury exposure from working with mercury since I was, 19 years old, right? And not knowing anything for pretty much 20 years.
So you were working in a dental office, right?
Yes, as a dentist, right? So first in dental school at age 19, when I started working with mercury, right?
Yeah.
And then after graduating, and there's accumulation and the displacement of the needed minerals, right? And then I'm going, why can't I replace my estrogen? I need it, right? My bones are asking for it. And then every time I try it, I go nuts, right?
Wow.
So now we know why, right? The inhibition of the COMT enzyme, right?
I think, I'm making a prediction, and we're all about a ripple effect. Our goal is to increase our circle of influence for good globally. You think about all the women who are going to hear your words you just said about anxiety and can't handle estrogen. There are so many women trying to tweak their estrogen and their progesterone, but they need testosterone too. And all of those things have to be affected by that.
Mm-hmm. Yes.
Wow.
The insomnia, right? I can't sleep because you have this rush of adrenaline, right?
Absolutely.
It's not being metabolized. It needs that enzyme to be broken down, right? It's very interesting.
And so when someone comes into your office and they have a bunch of amalgams, do you order like a blood test or anything to see if that mercury is affecting those hormones?
Well, as a dentist, we usually don't order labs, right?
But you could send somebody.
Yes. And I would probably recommend them to get those things done by their physician.
Yeah.
And in my job, it's like I'm the contractor, right? I am demolishing and rebuilding better, right? Taking away anything that could be toxic and then adding things that are the least toxic we can find. And the patient,
I was so impressed the first time I came into your office, and you had me swish with ozone water 15 times. I'm saying, this doesn't taste that great. But and then it hit me when I did my ozone training. I remember Dr. Schallenberger saying, 1 molecule of ozone can kill 3,500 bacteria in 1 second. So, that's why we rinse with ozone water. Tracey, I know you're going to ask a question.
Well, our audience, they're used to going to dentists. Biological dentistry is new. A lot of people haven't heard that term. And another term they haven't heard is ozone therapy. And I think it's really important to talk about that for a little while. I'd like you to, Dr. Veronica, I'd like you to talk about ozone therapy, what it is, and how you use it in your office. Because I know all about it. Doc knows about it, but I definitely I think our listeners don't. So
that'd be great.
Yeah, let them in.
I just love ozone. Ozone is, a very powerful disinfectant, and as long as you don't breathe the pure gas, it is extremely safe. And so, 3,000 times stronger than chlorine, and we can drink it, right? You cannot drink pure chlorine, right? But we can drink strongly ozonated water, right? And we can disinfect the mouth with it. So imagine now you're getting a shot, we're numbing you, and we give you ozone water to swish. So we're not pushing bacteria into your bloodstream with that needle, right? Instead of just going in there and just placing the little, numbing gel and pushing the needle in, and now you're pushing all the bacteria they're sitting on that skin, right, into the bloodstream. And so, it's all in the little details, right, in regards to biological and holistic dentistry, right? Because we're thinking about your entire body. Wow. And most people are not going to have any problems with that. But you may find that one person that has a very weak immune system, right? And you just put that needle in there, and suddenly now they have an infection in their heart from bacteria that got in there from the mouth, right? But ozone is a very strong, disinfectant. It is 3 molecules of, oxygen that, they want to dissociate because it's not very stable. It's not a stable molecule. So when that third molecule dissociates from ozone to, so you have O2, which is oxygen, and then you get that free radical, which is extremely dangerous and powerful against all microbes, right?
Right.
But it's basically harmless to us as long as we don't breathe it, the pure gas, right? So because we have antioxidant protection in our cells against ozone, except for the lung cells, right? But we can put ozone in the blood, we can put ozone anywhere, and it will kill all microbes, because microbes do not have antioxidant protection against ozone, and they cannot become resistant to ozone like they do with antibiotics, right? And so we use ozone in the office to disinfect, teeth, like before we place a filling. We don't want to sandwich bacteria in between the filling and the tooth, right? It's used in the form of ozone water, so it's the water that goes in our equipment. So there's no biofilm forming in the lines of our equipment because the ozonated water is constantly there, so it's coming out of the the drill. It's coming out of the ultrasound tooth scraper, right? When people are getting their teeth cleaned. So yeah, ozone is just the most incredible thing. And it's so inexpensive. You pay for the ozone generator and then you can generate ozone, anytime you want. And it doesn't cost you as much as anything else would cost. It releases nitric oxide in the body and it gives you energy. It is also released, it's metabolized into peroxides, which is what the immune system uses to signal the cells, hey, come here, let's do this hard work right now. So I think ozone is just amazing.
That was a great explanation of ozone.
Thank you.
Are you sure you don't teach the ozone course?
Maybe someday.
Yeah, fantastic. As you were talking about that, I thought about that experience that almost took me out. And you probably wouldn't tell people this, but my experience was a dentist gave me a root canal while I was under conscious sedation without my permission. And, several weeks later, it takes weeks to get the bacteria to get deep into the bone. But about 3 weeks, I think, I don't remember exactly, but it was right before Thanksgiving. And I was kind of reflecting on this last 9 years. So it's about 9 years ago that it happened. And I went into the hospital and they couldn't see it. I told them I had an infection. They diagnosed me having gout. So we kind of went back and forth in the emergency room for a week and they finally listened to me. But man, something like that from a dental procedure, most people would never think of that. It's a possibility. You're not going to tell people that, but I'm telling you, this is not from Dr. Montgomery. This is from me. This is my experience. Your experience may be different. But before you go have that root canal, consider maybe pulling the tooth and getting an implant. And that brings us to the point of the difference between zirconium and titanium. Maybe that's a good time to talk about that as far as implants.
Yes, I love that the mouth was created to be a closed system, right?
Yes.
So bacteria kind of stay out here, right? And so they should not be into our body, into the system, into the blood, into the bone, right? And so, and the whole mouth was created to work that way. So we have gums that should seal the tooth, right? So, and anytime there's a breach, we will get an infection, right? Because they are always in the mouth and they're plentiful. There's no way that you're going to, even when I gave you ozone, 15 times to swish with the ozone water, we know that hours later, your mouth is going to start to get repopulated with bacteria again, right? Sure. And so metal implants, titanium implants, do not provide a good seal of the gum tissue because gum fibers do not like to attach to metal. Wow. And so zirconia implants, the ceramic implants, have this massive advantage over titanium implants, is that the gum tissue sticks to the implant. And I'm going to talk specifically about the brand that I use because it's a single one-piece implant. We don't have two parts for that implant. It's a one-piece solid zirconia implant, right? There's nowhere for bacteria to try to penetrate anywhere, right? Especially when you get a good seal of gums around an implant. And so the system stays closed, right? The mouth is still a closed system when we use a ceramic implant. And because metal implants, titanium implants, most of them will fail, not most of them, 20% of them will start failing in the first 5 years.
Wow.
And we know, like
That's
with the
fast.
specific brand of zirconia implants that I use, the study that just came out a couple of years ago says that a 15-year of longevity study on that specific brand showed almost 99% survival rate. We don't see that with metal implants. Another thing is that titanium implants corrode too. Ooh,
Oh dear.
right? In the presence of, acidity in the mouth, fluoride, believe it or not, fluoride will corrode your metal implants, right? And cause them to release metal particles in the bone, right? That trigger autoimmune reactions. So we have these beautiful immune cells called macrophages, right?
Yeah.
And they exist to eat bacteria, right? Viruses, they engulf them, they digest them, right? They take them away from the area. They will try to do the same thing with these metal particles, titanium particles. They engulf them, but they can't digest them, right? They can't get rid of them. So what do they excrete then? Cytokines, right? There are, again, mediators of inflammation, right? Recruiting more immune cells to the area. Hey, Houston,
I need some help down here.
right?
Yeah.
Let's get this thing out of here because it's not meant to be here. So we don't see that with zirconia implants. And on top of that, zirconia is prettier. It's white.
Yeah.
They cost a little bit more. They're a little bit finicky, to place compared to titanium implants. And that's why titanium has been on the market, for decades. That's what people are used to. But now we have much better alternatives with zirconia implants. And they're not easy to break, like many people will tell you. Oh, we don't place ceramic implants because they break. And that's not true, right? They have a much stronger compressive strength than a titanium implant. They don't have a lot of flexural strength, but you could only break an implant made of zirconia if that would break a tooth. So you would have to get punched really hard, or assaulted. Your mouth would have to get assaulted in a way that you would break a tooth for an implant like that to break. So you would probably break a titanium implant before you would break a zirconia implant made of one piece zirconia. I'm not talking about two-piece zirconia implants.
Right.
So as you said that, I thought of a person, average patient. They go into the dentist, they get the titanium implant, and they think I'm good. I'm good. And then slowly over time, it starts to ache. They could get an autoimmune reaction because of all of the cytokines, all of the macrophages being called in to attack this tooth. And we're thinking, well, why do I have this pain? Why do I have this inflammation? After all, I have an implant there. It should be good. Do you hear that story from time to time?
Well, it's sad because a lot of times, I have patients that come to me and they have a mouth full of these implants, right? Wow. And it's hard because they spent, tens of thousands of dollars rebuilding their mouths. And now I have to tell them that I'm so sorry. It was just... it's just the kind of material, right?
Oh, man.
And many of them decide not to have them removed because it's a substantial amount of money and work to go through everything again, right? They're not easy to remove.
Big process
No.
for your office to safely remove all that stuff and then make sure that they get a good, good growth and good implant.
Yeah, when you remove them, right? You don't want to touch them with a drill or anything like that because you don't want to release even more particles in the bone, right?
Wow.
You have a way of removing them too that is safer than just taking a drill to the bone and trying to avoid the implant or not touching the implant because that's very dangerous too.
Wow. Tracey.
So Dr. Harmon, you touched on root canals just a little bit. So I want to talk about root canals just for a little bit. Dr. Montgomery, can you talk about, because obviously you have the implant. So do you recommend people with root canals getting the root canals removed and then getting implants?
If you have infection in a tooth, right, we recommend that the tooth be extracted and you get an implant. We have a couple exceptions. If it's a child and the jaw bones are still growing, right? We need teeth in the mouth for the jaws to grow. So by the time, they're 25 years old, it's a very safe age to have, now you don't have to do any more orthodontics. Now everything should be done with. So now, yes, it would be a good idea to replace that tooth with a ceramic implant. Now, another situation would be, people that have taken medications that basically impair the ability of the bone to heal. And so in those patients that have taken these classes of drugs called bisphosphonates and some biologicals that impair bone healing, unfortunately, in those situations, we'll have to tell the patient, the root canal in this situation is the safest thing to do, because if we do extractions in those patients or if we place implants, they could end up losing the entire jawbone because of the bone not healing and actually getting necrotic, dying because of side effects of those drugs.
It would be important to tell people what bisphosphonate is, Fosamax.
Fosamax, Boniva.
Yeah, they tell you to take it to increase your bone density, but one of the side effects is hip fractures.
And jawbone lesions and jawbone death. And so patients that have taken those drugs usually can't have extractions and can't have implants placed. So they're stuck with a root canal, which would be like the least of the two evils, right?
Wow. Ingredients matter. I talk about that all the time. Ingredients matter in everything. Ingredients matter.
Yep.
Wow. Man, I said mind blown already. I think when our listeners hear some of this stuff, they're going to try to, if they're like over in Europe or something, they're going to try to find a biological dentist. Are there even biological dentists in, outside of the U.S.?
I think there are. They can look at the IAOMT.org website and search for dentists.
IOAMT?
IAOMT.
IAOMT.
It's the International Academy of Oral Medicine and Toxicology. So, and the IABDM.org too. They have lists of dentists, in many, probably all over the world.
I know we're already at, about 45 minutes, but I think we need to talk about scars and their relation to meridian and tooth extractions and all of those things. I think it's very important for us to talk about that.
Okay, so we have these circuits in the body called meridians, right? So basically every cell in the body needs electricity to function, right? So they have a voltage, and the voltage varies by cell. Like the brain cells carry a higher voltage than, like your epithelial cells, but they all need voltage to function and to multiply. And so the muscles are the batteries. They generate the electricity as we move and exercise. And that's why someone that is bedbound is more likely to be in poor health than someone that is walking and moving around, right? So we're making the electricity, the energy that these cells need to function. So these channel circuits that, carry the electricity throughout the body are called meridians, right? And so we know that because of, pH changes and the fluid in the tissues, the electricity may be impaired. The connectivity, the transport of electricity can be impaired by infection, for an example, right? So a bad tooth, a dead tooth, right, has a different pH than a healthy tooth. And so the voltage will change when the pH changes, right?
Yeah.
And so infections will impair the conduction of the electricity. Scar tissue, because scar tissues don't have living cells. They're just fibrous tissue. So it's hard to move electricity through them because there's no living cell in scarring, right? And then the other one is metals. So metals will, we all know that, right? That metals will impair the movement of electricity too. They create scatter, right? And so we see, like in my cone beam x-rays, when I have a lot of metals in the mouth, the x-ray is all scattered, right? The energy was scattered when the picture was taken. And so how do we correct the movement of electricity in the body? Because if there's impairment in one spot, maybe an organ that was down the road from that spot may not get enough electricity, right? And then these cells are like starving for energy to be able to properly function. And so that's why in dentistry, we don't like to use metals in people's mouths, right? We don't want to create scatter in the mouth. We don't like bad teeth, right? Bad teeth, they do not allow the electricity to flow through them, right? And scarring, we don't see a lot of scarring in the mouth, but, I remember years ago, I was not happy with, after having my twins and, maybe I should know what about a tummy tuck, right? And I was like, oh, heck no, that huge scar going from one side of the body to the other, right? And so many meridians are going to go through that spot, right? And they are not going to like that. And so there are like physicians and naturopathic doctors, right? Integrative doctors who will treat scars to allow electricity to flow through the tissue, right? In dentistry, we try, right, as hard as we can. It's hard with implants and implant patients, but try to get the metal out of their mouths and then get, that teeth out of the mouth, because we want to reestablish the movement of electricity throughout the entire body.
Yeah, so if someone is interested in that, look up neural therapist, Neural. I used to do that. I used to do scar injections, and I would tell people scars that are in the midline or that cross the midline. So even tonsils, episiotomy, C-section scars cross the midline, they can have horrible, horrible symptoms. And all through that study of neural therapy, meridian tissue, so the collagen that forms the meridian channels, actually they found that they conduct electricity much better than normal skin. So what you just said has a scientific basis. It's well known. Some people, you talk about the meridians, they go, oh, that's just all that Chinese stuff, but it's real, and it's a change in the ability of those collagen fibers in the meridians to transmit electricity much better than normal tissue. And somebody can have weird symptoms from scars, especially in the midline or that cross the midline, or on their scalp. I did injections on people who had headaches forever and couldn't get any answer, and then it's with procaine and some B vitamins, but injecting that and then their headaches go away. It's like life-changing. Sure. Even, this sounds kind of funny, even, for example, a woman who's had an episiotomy and from that time forward has painful sex, can't figure it out. A good neural therapist can inject that, and it alleviates that problem. There's probably thousands of women who are going to hear this, that it's changed their married life forever after an episiotomy. And it's because of that change in the tissue, having scar tissue there.
There's words that we've used that people don't know: ozone therapy, biological dentist. Another one that Dr. Montgomery touched on is cone beam scan. Nobody knows, your regular dentists don't do cone beam scans. You have to go to specific places to get cone beam scans. So I'm really glad that you brought that up, because I want our audience to know that they really need, I think that a cone beam scan should be part of your yearly, every year you get a cone beam scan. You get things done every year. I think that should be part of your yearly checkup that you should do. So I'm really glad that you brought that up. Is there anything else that you can think of that normal dentists, I hate to say that word like that because I love dentists, right? I have really good friends that are dentists. But is there anything else outside of, like, biological dentistry that people may not know that they need to know? If they're calling around, if they're asking for biological or holistic dentists, what else do they need to know? Ozone therapy, cone beam, like what else do they need to know about that office if they're searching for a new dentist?
Make sure that the dentist is truly committed to holistic biological dentistry, because you have dentists that will say, oh, I remove mercury safely, but I still use fluoride in my office, right?
Ooh,
and so, there's a lot of that. And patients are sometimes unaware that what they're getting in their tooth, the filling, has fluoride in it when they don't want that, right?
Right.
And so if you want fluoride, go for it, right? But we are fluoride-free office. We are mercury-free and mercury-safe, right? Which is different. Yes, ask if you have, cone beam, a computerized tomography, which is the CT scan, is a cone beam CT scan. Ask if they remove these fillings safely, and actually go on the websites and see how it's done, so you will know what questions to ask, right? Do you protect your employees, right? Do you protect yourself, right? Do you use the best biocompatible materials you can find, right? Do you concentrate on teaching your patients how to eat in a way that they don't get cavities, right? Because it's not all about fluoride. It's mostly about what we eat. And so how do we educate people? And the Weston Price Foundation is a great place to go to learn about how to eat for your teeth and for your bones, right? Teeth love liposoluble vitamin-rich foods. So vitamin A, D, K, and E, right? Look for foods that are rich in that. Teeth love that. Unfortunately, teeth don't like veganism. People that are vegans, they tend to get a lot more cavities. And so tooth decay, I always tell my patients, it comes from the inside out, right? Not the outside in. So teeth love meat, butter, tallow, ghee,
Yum.
animal fats, right?
Yeah.
They love steaks, they love chicken, they love the chicken skin. And be mindful, all of these things have to be organic and pasture raised, and right? Bone broth, right? Teeth hate refined carbs, right? They can't live. They can't be healthy if someone is consuming refined carbs all day long. So that's your bread, your pasta, donuts and cakes, and teeth can't be healthy even if you bathe them with fluoride all day long, right? Because again, we depress the immune system when we eat that way. And when we eat healthy, getting our carbs from mostly fruits and vegetables, so 2/3 vegetables, 1/3 fruit, and we eat protein from animals and fats from animals, our teeth are going to be happy. They heal decay. I mean, it's incredible. I see, the changes when patients decide to follow the rules. Their teeth will be happy. If not, they will keep struggling, and there's nothing that we can do to help them. I can fill your teeth 10 times, and the tooth is going to end up dying if you don't change the way you eat. And of course, there are exceptions to that. People that have had radiation to the saliva glands and they don't make saliva anymore. There are exceptions to that, but the main cause of tooth decay is a poor diet.
And I would be remiss if I did not give this information to our listeners. There are people who have had their gallbladder out.
Oh, yes.
The gallbladder makes bile. What does bile do? It breaks up the fat it breaks up the fat where the fat soluble vitamins live or exist. And so what happens now, instead of your liver is constantly making bile, it's about a drop a minute, and it gets sucked up in the gallbladder, waiting until food called chyme comes out of the stomach into the small intestine. And that sound that you hear when you're sitting there after meal going, that's your gallbladder squirting bile onto that substance. to break it up into small particles. If you've had your gallbladder out and you don't take bile with every meal, your A, D, E, and K, like Dr. Montgomery talked about, that you need is going to end up in the sewer. Not going to be able to absorb A, D, E, and K, and your teeth are going to suffer. So go to the health food store, get some ox bile. That's what they list it as most of the time. Something that had bile acids in it. You take 2 of them before a meal, before you even eat, so that A, you can make bile, but also you're getting this large amount of bile so that you'll be able to emulsify the fats that you eat.
Correct.
Got to do it. You got to do it if you want healthy teeth. But also, what does vitamin D do? It turns on your immune system cells. So if you find yourself getting sick all the time, it might have something to do with it. So these are the kind of things that people get on Root Cause Holistic. Little gems for life. I've told so many people, and I've had so many patients when I was in practice, they come in and they say, I look at their health history. They say, I had my gallbladder out like 10 years ago. And I said, did your doctor tell you that you need to take bile with each meal for the rest of your life? Guess how many times a doctor told them that? 0 in 35 years. No doctor ever told a patient to take bile. They said, no, you don't need your gallbladder.
Yeah, my sister's a general surgeon. Yeah, I get that.
Yeah, that's all we're going to say, right?
Yep. Oh my gosh. What a fantastic conversation.
Yeah. We could talk to you for hours, but maybe we'll have to have the second episode so it's not too long.
Oh, we totally could go on. I think today's biggest takeaway is that our mouths are much more than a smile. They're the gateway to understanding what's happening throughout the rest of our bodies, whether it's inflammation, airway, health, hidden infections, or simply taking a more preventative approach. Today's discussion reminds us that oral health truly is a whole body health. And I love how she touched on, what we need to eat, getting back to the basics. Dr. Montgomery, thank you so much for sharing your expertise and helping us better understand.
Thank you. I really appreciate it. Mm-hmm.
Of course.
This was fantastic. I think with this podcast, we will be changing lots of lives in the years to come. So that I want to thank you as well.
Thank you. I appreciate it.
If you've enjoyed today's episode, we'd love for you to subscribe, leave us a review, or DM us. Dr. Harmon and I love the DMs. We get messages all the time. We love hearing from you. And if you've never heard of biological dentists, please look for a dentist. And if you're in the Idaho area, you definitely need to go see Dr. Montgomery. As Dr. Harmon has said, she is his dentist. And for him to put his stamp of approval, that's pretty big. So stay grateful, stay grounded. Until next time.
Thanks for tuning in to Root Cause Holistic Health. We're here to help you uncover what's really going on and empower you to take the next step in your healing journey.
Whether you're a mom, a dad, or just someone ready to stop settling for Band-Aid fixes, we hope today's episode gave you something to think about.
If you found this episode valuable, do us a favor, share it with someone you love, and leave a review so we can reach more families like yours.
Make sure to hit follow so you don't miss next week's episode. We've got more honest conversations, practical tips, and root cause wisdom coming your way.
Until next time, stay grounded, stay curious, and most of all, stay connected to what truly matters.
We'll see you next time on Root Cause Holistic Health.